Hello, my name is Anna Mendez. Today I'll be presenting my quality management and performance improvement program for dialysis fluid management. This project focuses on improving fluid management outcomes in dialysis patients using Lean Six Sigma principles. The goal is for this presentation to clearly explain the problem, why it matters, the organizational setting, and the structured improvement plan that was developed using evidence-based quality improvement methods. The project did not start from scratch. It builds directly on my earlier course assignments where dialysis fluid overload was identified as a reoccurring patient safety and quality issue. Throughout the course, we learned how Sigma and the science of improvement can be applied to real healthcare problems. And this presentation helps all of that learning together into one cohesive improvement program. So rather than presenting isolated ideas, this project integrates analysis, DMAIC tools, and data evaluation into a complete quality management plan. The core problem addressed in this project is excessive interdialectic weight gain, or IDWG, in hemodialysis patients. Many patients gain more than 3 to 4% of their dry weight between treatments, which places significant strain on the heart and lungs. Research shows that excessive fluid intake directly contributes to hypertension, shortness of breath, and increased hospitalization risk in dialysis patients, making this a persistent and preventable quality issue. This problem is significant for several reasons. Cardiovascular disease accounts for nearly 50% of deaths among dialysis patients, and fluid overload is a major contributor to those outcomes. From a systemic perspective, fluid-related hospitalizations increase Medicare spending and negatively impact dialysis facility quality scores. So, according to CMS, dialysis facilities are closely evaluated on hospitalization and patient safety metrics, meaning fluid management is both a clinical and regulatory priority. Addressing this issue improves patient outcomes while also supporting organizational performance. This quality improvement program is designed for an outpatient dialysis organization caring for patients with end-stage renal disease. These patients often have multiple chronic conditions and require highly coordinated interdisciplinary care. The organization operates in a CMS regulated environment where outcomes such as blood pressure control, hospitalizations, and patient safety are continuously monitored. Because dialysis care is already standardized and data driven, it provides an ideal setting for Lean Six Sigma based performance improvement. The improvement framework selected for this project is Lean Six Sigma using the DAMIAC model. This approach was chosen because it emphasizes reducing variation, using data to guide decisions, and sustaining improvements over time. The science of improvement supports this structured methodology by encouraging small, testable changes that lead to measurable outcomes. So together, these frameworks ensure that project is systemic, evidence-based, and aligned with healthcare quality standards. In the define phase, the problem was clearly stated: excessive IDWG, interdialectic weight gain, um, contributes to fluid overload, hypertension, and preventable hospitalizations. So this project the goal was set to reduce excessive IDWG by at least 20% within 6 months. Key stakeholders were identified, including dialysis nurses, technicians, dietitians, nephrologists, care coordinators, and patients. Critical to quality factors focus on patient understanding of fluid limits, consistency of staff education, and accurate monitoring of fluid intake. During the measure phase, baseline data were collected on average IDWG, blood pressure trends, and fluid-related hospitalizations. So when the data we was analyzed, significant variation was identified in how fluid education was delivered across staff. The root cause was analysis in the analysis was revealed that health literacy gaps, inconsistent messaging, and lack of visual self-monitoring tools were major contributors to poor fluid control. So this analysis reinforced that the issue was largely system-based rather than patient non-compliance. The improved phase introduced this program, the fluid management quality program intervention. This included standardized fluid management education for all the staff, the use of visual tools such as color-coded water bottles and fluid tracking charts, and the teach back method to confirm patient understanding. Evidence shows that structured fluid control interventions reduce hypertension and cardiovascular risk in dialysis patients. By simplifying education and improving consistency, this intervention targets the root cause identified in earlier phases. The control phase focuses on sustaining improvements over time. Monthly monitoring of IDWG and blood pressure trends allows the team to quickly identify regression. So, education documentation audits ensure staff compliance and best practices are reinforced during regular staff huddles. Lean Six Sigma emphasizes that without control mechanisms, improvements are often temporary, so this is essential for long-term success. Program effectiveness is evaluated using both outcome and process measures. Outcome measures include average IDWG and the percentage of patients exceeding weight gain targets and fluid-related hospitalizations or emergency department visits. Process measures track education and completion rates and staff compliance with standardized teaching. Data are reviewed using run charts and pre and post intervention comparisons to determine whether observed changes are meaningful and sustained. So this project is strongly supported by the literature Lean Six Sigma principles guide process improvement and sustainability, while the science of improvement reinforces continuous testing and measurement. Clinical research consistently links fluid overload to hypertension and cardiovascular risk, and systemic reviews demonstrate that poor fluid control worsens cardiorenal outcomes. CMS guidance further emphasizes the importance of reducing hospitalizations and improving dialysis quality metrics, aligning this project with the national standards. In conclusion, fluid overload is a common preventable quality issue in dialysis care. This program demonstrates how structured quality improvement methods can actually translate evidence into practical, patient centered solutions. Um, by integrating Lean Six Sigma tools, clinical research, and regulatory expectations, this program promotes safer care, better outcomes, and stronger organizational performance. Overall, this project reflects how quality management principles can be applied to real-world healthcare challenges. And this is going to be my references page that I um, added. So it has the evidence base of the quality improvement framework, the clinical significance, and the evaluation strategy that I used throughout this project. Thank you so much for listening.